Pleasant day, everyone. Today, I will be discussing an immunity breakdown about the Guillain-Barre syndrome. This immunity breakdown consists of Guillain-Barre syndrome's common age of onset, its occurrence in the population, its cause, a brief description about it, the diagnosis and treatment, and the health and coping mechanisms of GBS. First off, its common age of onset. So GBS can affect individuals of any age. In the United States, it is more commonly observed in men and adults, with the incidence peaking in the age of 50 to 70 range. Its occurrence in the population is relatively rare, with an incidence of approximately 1 to 2 cases per 100,000 people annually. CDC estimates that only about 3,000 to 6,000 people develop GBS each year in the United States. So this data can confirm that GBS is really rare. Next, the cause of GBS. So GBS cause is not well understood, but it can be triggered by an infection. Common triggers include bacterial infections like Campylobacter jejuni and viral infections as well, like Epstein-Barre syndrome, cytomegalovirus, or respiratory and gastrointestinal infections. So the images below shows the structures of the different triggers of GBS. The next, a short description of GBS. So let us try to describe GBS according to what was already presented. So GBS is rare, and we already know that it is a neurological disorder where the immune system mistakenly attacks the peripheral nerves. So it is an autoimmune disease because of this. And it often follows an infection and causes muscle weakness, diminished sensations, and potential paralysis. Most people with GBS recover fully, but it can take weeks or months, and treatment focuses on managing symptoms and providing supportive care. If you suspect GBS, seek medical attention for a proper diagnosis and treatment. While GBS can be a serious and potential life-threatening condition, it is not always fatal. While the majority of individuals with GBS recover with proper medical treatment and support, there are cases where complications can arise, such as difficulty in breathing or cardiovascular problems, which can be life-threatening if not managed promptly and effectively. Next, the diagnosis of GBS is primarily clinical, supported by the patient's history and physical examination. The key diagnostic tests include lumbar puncture, electromyography or EMG, and nerve conduction studies or NCS, and then magnetic resonance imaging or commonly known as MRI. When it comes to lumbar puncture, elevated proteins levels in the cerebrospinal fluid with normal white blood cell count. So a lumbar puncture for diagnosing GBS involves inserting a needle into the lower back to collect a sample of CBS, or cerebrospinal fluid, which is then analyzed for markers of inflammation or that may indicate the presence of GBS. So the advantages of lumbar puncture for diagnosing GBS is it provides diagnostic information, being minimally invasive, and it offers rapid results. However, disadvantages include discomfort and pain during the procedure, risk of complications such as headache or infection, and the possibility of false negative results. EMG and NCS are tests used to measure the electrical activity of muscles and the speed of nerve signals, showing characteristic patterns of demyelination. EMG uses a fine needle electrode to detect electrical signals in specific muscles, which are then analyzed to assess muscle health and nerve function. Nerve conduction studies, or NCS, stimulate nerves with electrical impulses and record responses to evaluate nerve function, including conduction speed and the presence of abnormalities like nerve damage or compression. EMG offers detailed assessment and specificity in diagnosing nerve and muscle disorders, providing real-time results. However, it can be invasive and uncomfortable, requiring specialist expertise for interpretation, with potential limitations in detecting certain conditions. Conversely, NCS are non-invasive and widely available, offering objective measurements of nerve function, although they may provide limited information on the cause or location of nerve damage. While NCS relies less on patient cooperation, it may produce false negative results and require expert interpretation. And the magnetic resonance imaging can be used to rule out other conditions and may show nerve root enhancement. MRI provides also detailed visualization of nerve damage and identifies alternative causes of GBS symptoms. While it is non-invasive, it has limited sensitivity, cost, accessibility, potential for false positives, and use of contrast agents pose challenges. Thus, while valuable, MRI is most effective when used alongside other diagnostic methods for comprehensive evaluation of GBS. Next, the treatment of GBS. So the treatment focuses on managing symptoms and speeding recovery. It includes IVIG, or the intravenous immunoglobulin, where it involves injecting high doses of immunoglobulins to neutralize harmful antibodies. Supportive care as well. This includes monitoring respiratory function, managing pain, preventing complications like blood clots, and providing physical therapy to aid in the recovery. And another also is the plasmapheresis, or the plasma exchange in simpler terms. So this removes the antibodies from the blood that are attacking the nervous system. So the IVIG therapy offers several advantages in treating GBS, including its ability to modulate immune response, reduce inflammation, and potentially accelerate recovery. IVIG is generally well tolerated and can administered relatively quickly, making it suitable for both acute and chronic phases of GBS. However, IVIG treatment can be associated with therapy disadvantages, such as the high cost of therapy. It is kind of expensive, so the potential for adverse reactions, including headache, fever, and allergic reactions, and the need for hospitalization or frequent clinic visits for administration. And additionally, some patients may not respond adequately to IVIG therapy, necessitating alternative treatment approaches. And the plasma exchange swiftly reduces harmful substances in the blood, aiding GBS syndrome recovery, especially for patients unable to tolerate IVIG. However, it demands specialist equipment and carries risks like infection and vascular complications, emphasizing the need for careful patient selection and monitoring. Lastly, the supportive care in treating GBS provides pain relief, respiratory support, and physical therapy to maintain muscle function. However, it may require prolonged hospitalization, medication side effects, and pose risks of complications like pressure sores. So GBS is considered an autoimmune disease because it involves the immune system attacking the body's own peripheral nerves. The exact mechanism behind this autoimmune response are not fully understood, but molecular mimicry, where the immune system mistakes nerve components for infectious agents, is thought to play a role. Next, the health and coping mechanisms of GBS. So coping with GBS involves both medical treatment and supportive measures. First is a physical therapy. This helps regain strength and mobility. The next one, the occupational therapy. Occupational therapy assists in adapting to changes in physical abilities. So physical therapy is more involved on the regaining strength, while occupational therapy is more involved in assisting and adapting to the changes in the current physical abilities. So it helps you adapt from what you can do before from what you can do now. And then another coping mechanism is psychological support. Counseling or support groups can help patients and families cope with the emotional impact of GBS. So psychological support enables the patients to feel the changes in their lifestyle now. They will be able to grasp their emotions and be able to share what they feel so that they will be able to live their new life more comfortably. And then next is patient education. So understanding the condition, course, and treatment empowers patients for better management and rehabilitation. So awareness of GBS awareness about GBS as well as the prognosis and treatment of this can really be a great help for the patient to become more able to manage and be able to rapidly rehabilitate. So these are the references of my report. And thank you for listening. And before I end my presentation, let me show you a brief video that will enable you to understand GBS more.
Guillain-Barre syndrome is a rare medical disorder in which the body's immune system mistakenly launches an attack on the peripheral nerves. The attack is mainly targeted at myelin, which forms the insulating layer around the axons of neurons and helps to prevent electrical signals from decaying due to leaking out. When the myelin sheath is damaged, nerves are not able to conduct electrical impulses normally, and, in case the damage is severe, the underlying nerve can even die. It is an autoimmune condition which is typically triggered by an infectious illness, such as the stomach flu or a lung infection. The exact underlying cause is still under surveillance. It is believed that structural resemblance between the attacking microbes and some molecules in myelin fools the immune system, and the immune system starts attacking body's own nervous system. The syndrome may be triggered by infection with Campylobacter, influenza virus, Epstein-Barr virus, cytomegalovirus, Zika virus, hepatitis virus, HIV infection, and mycoplasma. In some instances, increased risk has been observed with surgery, Hodgkin's lymphoma, and rarely with influenza vaccinations or other childhood vaccinations. Symptoms usually start as weakness in the feet and legs that gradually spread to the upper body. Tingling or pins and needle sensations also qualify for the first symptoms and usually involve the fingers, toes, ankles, or wrists. There may be difficulties with eye or facial movements such as blinking, chewing, laughing, swallowing, or speaking. Gradually, with more damage to the nerves, patient develops unsteadiness while walking or inability to walk or climb stairs. Patient can complain of easy fatigability and severe pain that may be worse at night and crampy or achy in nature. It is seen that most significant weakness is experienced within 2 to 4 weeks after symptoms begin. Patient may also experience difficulty with retention of urine and sluggish bowel movements. In addition, rapid heart rate, difficulty breathing, and wide fluctuations in blood pressure can also be seen. Guillain-Barre syndrome can cause weakness or paralysis of the muscles that control the breathing. Up to 30% of people with this syndrome need breathing assistance from a respiratory machine during their hospitalization. Due to long-standing immobility, these patients are at risk of developing blood clots. Being immobile also puts the patient at risk of developing bed sores. Around 3% of the patients experience a relapse. Guillain-Barre syndrome can be diagnosed by a careful medical history through physical examination and certain tests. Spinal tap can be done to withdraw a small amount of cerebrospinal fluid, which is then tested to make the diagnosis. Electromyography is a helpful test in which thin needle electrodes are inserted into the muscles to measure nerve activity. Nerve conduction studies are conducted to establish the diagnosis. In this test, some electrodes are taped to the skin overlying certain nerves, and then small electric shock is passed to measure the speed of nerve signal. Guillain-Barre syndrome does not have a sure-shot permanent cure, but treatments are there to speed up the recovery and reduce the severity of the symptoms. Plasma exchange or plasmapheresis can be done in which the plasma, which is the liquid portion of the blood, is separated from the blood cells. This process eliminates certain antibodies present in plasma that contribute to the immune system's attack on the nerves. Immunoglobulin therapy is a promising treatment in which healthy antibodies are transfused to the patient, which block the action of those antibodies that mediate the damage in Guillain-Barre syndrome. It is essential to give respiratory support when needed, manage pain control, and prevent formation of blood clots. The standard of care includes physical therapy, training with adaptive devices such as wheelchair, and assisted or independent movement of the arms and legs to keep the muscles strong and flexible. Training and development of self-care skills plays a significant role in the overall treatment plan. Among adults recovering from the syndrome, about 80% can walk independently 6 months after the diagnosis, and about 60% undergo full recovery about 1 year after the diagnosis. For more information about Guillain-Barre syndrome, list of expert doctors, hospitals, and ongoing clinical trials, please visit www.expertdocs.com.
To be all, thank you for listening. And I will also be uploading patient stories and other video information to help you understand better GBS.